Alfonso. Dr. Alfonso is medical director for the Emory School of Medicine Physician's Assistance Program. She has been a medical director and officer for the Alliant Healthcare Quality System here in Atlanta. She has a lot of humanitarian work going on in South America, and she is one of our top Latin American physicians in the state of Georgia. So today, Dr. Alfonso, who's a family physician, is going to talk to us about the importance of vaccines. I know you think that the pandemic is over and it doesn't really apply to us anymore, but what we really need to correct is vaccine misinformation. So vaccines are still very, very, very important for those of us who are older, particularly those of us who are 65 years of age and above. And if you are taking care of grandchildren, it's really important that we get our immunizations. So at this time, I'd like to introduce you to my very favorite family physician colleague. We came along at Emory at about the same time. I think I'm about 1 year ahead of her in training. So at this time, I'd like to turn the mic over to our Dr. Susana Alfonso. Dr. Alfonso.
Thank you so much, Monica. I'm really excited to be here with you all. And thank you, John, for that wonderful warm-up. I can tell you that so far, this is the funnest webinar I've ever done. So blood is pumping, feel really stretched out, and I hope that now we can all exercise another part of our bodies. But just really grateful for that message about cardio is life. I think I'm going to steal that for my patients, that cardio is life. I'm going to share my screen and let's see. All right. And I'm hoping you all can see what I want you to see.
Yes, ma'am.
Okay, perfect. But now I cannot see what I wanted to see. Darn. Okay, here we go. Got it. All right, so we're going to talk about 4 vaccines today, and hopefully I'm going to focus on what's new and what's important. As Dr. Parker alluded to before, a lot of us, I think, got just tired of hearing about, COVID and vaccines, and it just felt like we were being inundated and everything was constantly changing. And I will say, I've worked in residency training now for about 24 years, and vaccines do always change. The recommendations are always changing. And just as we think we've got it down and we know the latest and greatest, there's an update. And so it's very timely for this talk that there's actually been an update in October. So I think you all are getting the latest and greatest information, but as I mentioned, there's always changes around the corner. So, but for now, there's been some really good changes. And even though it makes our job as healthcare providers a little tougher, I think, the reason that these things change is because we have better information. And so contrary to what my husband sometimes thinks is like, oh my gosh, you guys don't know what you're doing. It's because our information gets better and better. And so as we get more information, recommendations change. So let's jump in. We're going to start with COVID. And just as a quick reminder, and you all will have access to this information, I put it on there just in case someone was really curious, but we're definitely not going to go into all the nitty-gritty of the vaccines and how they work. But there are still 3 vaccines that are licensed here in the US: Pfizer, Moderna, and Novavax. And I think the only reason that it's really important for you to be aware of that is because of some of the updated recommendations that we're going to go to in just a moment. But these 2, the Pfizer and the Moderna, and I'm going to use branded names for the purposes of this vaccine. I think it's what's more commonly known out in the community, are both licensed for use in children 6 months or older. And I really think that's one of the distinguishing features between that and the third. Novavax is a little bit of a different mechanism. It's a protein, what's called a protein adjuvant. It just means it works a little bit differently. It targets a little bit of a different strain, but it is believed to be almost as effective. And the difference is about 5%. And a lot of times when you see these efficacy numbers, these are numbers that are within clinical trials. And so really there is oftentimes a bit of a difference between how things work in labs and clinical trials than in the real world. But the best information we have is that they are all three quite efficacious, even though the Novavax does work a little bit differently. Now, what is the goal? And I think it's important to understand for COVID and for others, a lot of my patients and my community would say, well, I got the COVID vaccine, but I still got COVID. So, the goal, the ultimate goal, the prize is really to prevent death, to prevent severe disease and prevent hospitalization. So people who went into getting their vaccine thinking, oh, I'm not going to get it. Now I'm not going to get COVID and got COVID and then were disappointed. That really wasn't the goal of the vaccine. The goal is to prevent severe disease, hospitalization, and death. Now, one of the things that's actually come out is that it also appears to prevent the chance that you get long COVID. And for those of you that haven't heard of long COVID is sort of this constellation of lingering symptoms that are really quite variable. Some people have fatigue. A lot of people have respiratory issues, whether it's shortness of breath or cough, brain fog. Lots of different things are out there kind of falling under this long COVID umbrella, but that really wasn't one of the points of the COVID vaccine, but that is sort of one of the bonuses that's coming out of being vaccinated, is that there appears to be a decreased chance that you'll be one of the people that gets long COVID. So what's new about COVID? So COVID is still recommended. There has been no recommendation to stop getting COVID vaccinations. I know back in 2023, when the COVID booster was being recommended, here in Georgia, we were at about 16% being vaccinated with a booster. 16% is pretty terrible. And so now there's a consistent recommendation to get the booster. But what's new is this. In October, and this is called the Advisory Committee on Immunization Practices, this body, we call it ACIP for short, they're the ones that meet yearly or more frequently and make recommendations on all of our vaccines. So when they met in October, they actually recommended a second dose of the 2024-2025 COVID vaccine. Some people are also calling it a booster. So this year's booster, 6 months after the first dose, for a specific group of people. Those are people age 65 and older, and people who are moderately or severely immunocompromised. There's a whole long list, but kind of a little short summary of who that includes are active people who are undergoing cancer treatment actively, people who have had transplants and are immunosuppressants, and people who are on high dose steroids. High dose is defined as 20 milligrams a day. In addition, and this is where I mentioned earlier that it would be important to sort of know what previous doses of COVID you've had, is this booster dose should be different from a different vaccine maker than your primary series, okay? Is that confusing? Yes, it is. And so what I encourage you to do is talk to your healthcare provider about this, because when you look at the recommendations, it's kind of tricky. It's like if you've had one of these or two of these, get one of that or two of those. But in summary, what I'd like for you all to come away with is that if you haven't had a booster, you absolutely should still get a booster. And if you fall into one of these categories, you should consider having another dose 6 months after the first one. So that's new. Flu. One of the things that's, and I didn't actually remember to look this up, and I apologize for that, but anecdotally, what I have experienced is that there is more resistance to getting flu immunization than prior to the pandemic. And now I'm going to be super curious and have to look this up after this webinar. I feel like some of my patients have sort of lumped in, the concerns around vaccinations and kind of thrown in other vaccinations as well. But influenza is still something that's out there. Influenza in 2023, where are my notes? There were 28,000 people died of influenza in 2023. There were 40 million people that got sick from influenza. So it is still a very common respiratory virus. It is still something that puts people in the hospital, that causes death. Who should get the influenza shot? Essentially everyone above the age of 6 months. Who's at higher risk? Young children, pregnant people, people with chronic conditions, and people age 65 and older. This is actually a little bit different. There's not this classification of moderate to severe immunocompromised. It includes a bit of a broader group of people with chronic conditions, and I actually have them on another slide, but there are things that are pretty common out there. Things like diabetes, asthma, smokers, anyone that's got a chronic renal disease, for example, chronic kidney disease, all those folks are considered higher risk. So even if you are not 65, but you have any of these other conditions, you are considered at higher risk from a complication of influenza, and you should absolutely get your flu shot. So I thought this was kind of interesting to just talk briefly about COVID versus flu. First of all, they are caused by different viruses. 3 of the vaccines that we're going to talk about today are caused by viruses, and 1 is caused by a bacteria, but these are all different viruses. So COVID is the COVID-19 virus, and influenza is caused by the influenza virus. So they are 2 completely separate viruses that cause 2 completely separate illnesses. Now, what's kind of similar about them is they both cause what's called a respiratory illness. And for a lot of people, it starts in the upper airways. And when we talk about upper airways, we talk about sort of from here up. But where they can both make you sick is when they cause lower airway disease. And that's where we get into situations of bronchitis or bronchiolitis or pneumonias. But some differences between the two: COVID is thought to spread more easily. It's thought to cause more severe illness. People take longer to show the symptoms. From the time they're exposed to the time they're having symptoms is believed to be longer. And it's in that longer stage where you're contagious, which explains a bit why it's spread more easily. And you're contagious for a longer period of time is the thought. And then there are these other longer lasting conditions that are associated with COVID that we really don't tend to see with influenza. Influenza is a little distinctive because it tends to cause more severe illness in young children than COVID does. So many of you all may remember that when the COVID pandemic was sort of in full swing, a lot of children were getting sick, but not a lot of children were getting really sick. And lots of children were out there and they were asymptomatic. So they are similar in that they are both respiratory viruses, but there are some important distinctions. So, is there anything new in influenza? No. Other than my belief that people are sort of not being immunized as much with influenza. And I apologize that I don't have that data for you because I really should have as I'm speaking it out loud. Respiratory syncytial virus, or RSV vaccine. This is actually new. This was first approved in 2023. Respiratory syncytial virus, or RSV, is similar to COVID and influenza, also a virus, also causes respiratory illness, again, upper airway or lower airway, and especially problematic for young babies and older adults. So for the 2023-2024 RSV season, which actually happens in the fall and the winter, so back in the summer of 2023, ACIP recommended RSV vaccination for adults older than 60 using shared medical decision-making. And the reason I highlight that for you is because since the recommendation was not age-based, since it was a, hey, have a discussion with your healthcare provider, it made it so that you couldn't just go into a pharmacy and get it. Pharmacies work under a protocol, and it wasn't something that was able to be put within that protocol because the recommendation wasn't age-based. However, and here's what's new, this was updated in June of 2024 to all adults greater than age 75, regardless of their health indicators, and then adults age 60 to 74 at increased risk. In addition to that, there was also a recommendation made for pregnant people between 32 and almost 37 weeks gestation. For now, the recommendation is 1 dose and 1 dose only. There are currently 3 vaccines licensed. Again, we're not going to go into how they're all different. I will send these PowerPoints if you all want to learn more about those, but they are some familiar makers, Moderna, Pfizer, and then GSK, which is GlaxoSmithKline. The one that I'm most familiar with is the Arexvy. That's what's available in our institution. The first one, the efficacies aren't as good as our COVID vaccines, but they were deemed to be sort of good enough. The last one, there is a tiny, and I only mention it because for those of you who are considering getting the RSV, if you start Googling, I'm sure this will come up, and I'd rather you hear it from me than, find it on Google or social media. But there have been a few cases and a few concern of something called Guillain-Barré and immune thrombocytopenia. However, there is nothing conclusive yet. I did want to just let everyone know that as of today, you still need a prescription in Georgia. So what does that mean? It means that as of today, you can't walk into your pharmacy and just ask for RSV and you'll get it. Unfortunately, we're one of only 4 states that is still doing that. And I think that now that the ACIP has come out and made an age-based recommendation, that will change. But as of today, unless something has changed in the last week, you still need a prescription in Georgia. All right. The last one we're going to talk about is the pneumonia vaccine. So many of you may have heard of the pneumonia vaccine. The pneumonia vaccine is something we use in children and babies, and in children and also in adults. The recommendations for the pneumonia vaccine have changed so many times. It's almost a little funny, not funny nowadays. There have been many formulations and recommendations in the last 5 years. But in general, pneumonia vaccine is meant to prevent disease caused by pneumococcal bacteria, which cause pneumonia, meningitis, and sepsis. Can also cause some other things, but by and large, those are the ones that can, really cause you a lot of harm. There have been many formulations, and I list them all there for you. Please don't try to remember all those. But it just goes to show you that you may have heard what sounds like some conflicting evidence from your healthcare provider. In general, the pneumonia vaccine has been recommended for everyone above the age of 65 and for people below the age of 65, so 19 to 64, with certain conditions. Again, we go back to the conditions we talked about before with influenza. These conditions that people think about don't necessarily, it's not like you have to have cancer to qualify for pneumonia vaccine. Smoking, diabetes, chronic heart, lung, liver disease, chronic renal failure are, quote, enough that you should actually have a pneumonia vaccine. You qualify as having sort of a special condition. So here's the update. The update is, again, in October, that now the pneumonia vaccine is recommended for all people, regardless of health status, above the age of 50, which is a big change. It's been 65 forever. Now it's recommended above the age of 50. And it's also recommended for patients age 19 to 49 with certain conditions. And here's an example of some of those conditions. This is not an exhaustive list. There's a bunch of other things, but these are the most common things that we see where you might be eligible for a pneumonia vaccine. So I just want to end with a little bit of a statistic for you all. So I mentioned that what we're trying to do is prevent death. And, for me, I say this to the residents all the time, we do a lot of things in American healthcare that don't save lives. And as a family physician, I focus a lot on prevention, a lot on lifestyle modification, a lot on maintaining health, whether it's physical health, brain health, emotional health, so that our patients can live longer, healthier lives. And so we talk a lot about cancer screenings. We talk a lot about checking cholesterols and screening for diabetes. And we also, immunizations is a big bucket in terms of prevention. And of those three things, this is a question I always ask the residents, which of those three things, cancer screenings, laboratory screenings, and immunizations, save the most lives? And it is immunizations. And which one do we do the worst as a healthcare system is immunizations. So there's lots of hard things to do. Changing your lifestyle, exercising all the time, doing that great routine that we did a little bit ago every day, those are hard habits. But getting your immunizations can be easy. And I know with the availability that we have nowadays, it's even easier. You can run to the grocery store and get your flu shot and get a $10 gift card. So even though we are doing better, there were still 76,000 deaths from COVID in 2023. And that was a drop from almost 250,000 potentially preventable deaths. Of the four things we've talked about, COVID was number one. Pneumonia actually was number two. So I encourage you to please talk to your healthcare providers, talk to your pharmacists. They're wonderful partners when it comes to immunizations. They are very proactive and make it very easy for you to go in and get your immunizations. And I'm happy to answer any questions that you have about immunizations.
Thank you so much, Dr. Alfonso. That was excellent. But I wanted to go back to some of the things that you were talking about, particularly the recommendations for who should get which vaccines. When we start talking, I understood diabetes, but I think, can you be a little bit more explicit about the people who meet criteria if they're less than 65? Diabetes, we got, asthma's one. You said smoking. Anybody who smokes, okay, everybody, you heard that. Anybody who smokes should be getting a COVID, a flu, a pneumonia vaccine, but a pneumonia vaccine in particular. Can you talk about the other medical conditions? Just be a little bit more explicit, because I think sometimes people don't quite get that. There are some questions in the chat. I've answered them directly, but if you could address some of them, I'd appreciate it in a little bit more detail.
Yes.
I know that in the clinic that I work in, it's a clinic for people who are underinsured, and we will give everybody a flu shot, and we will give people a COVID shot if we have them.
Yes.
Everybody doesn't have them.
Should I stop sharing?
Yeah, you can.
Okay.
No problem.
Okay. So, so let's talk about the ones that aren't really age-based. Okay. So COVID and flu are not so much age-based. If you're 6 months or older, you should get those immunizations. Okay. The series, the number, which ones, all of that is dependent on what you've already had, and that can depend on your age. But if you are more than 6 months of age, you should get a COVID or flu, recommended for everybody across the board. For pneumonia and RSV, this is where they are age-based. For pneumonia, it's now if you're above 50. So if you're above 50, you should get it. If you have RSV, if you're above 75, you should get it. Okay. It's the in-betweens where we think, okay, who should get those because they have higher risk. So for pneumonia, if you are less than age 50 now, used to be 65. It's going to take me a little time to get used to. If you're at less than age 50 and greater than age 19, so 19 to 49, you should get it if you have. So there are some things, if you are in active cancer treatment, you take immunosuppressant drugs, you have had a transplant, you have a CSF leak, cochlear implant, those are kind of more rare conditions. But the reason I highlighted the ones I highlighted is because those are common. The other ones are common: smoking, asthma, chronic renal failure, chronic lung disease, so COPD, emphysema, heart disease, if you've had a heart attack, if you've had a stroke, if you've had a stent. The only one that is still excluded is high blood pressure. So if you've had if you quote, just have high blood pressure, and that's the only thing you have your only medical condition, that is not yet considered, quote, enough to get a pneumonia shot early or an RSV shot early. Okay. But outside of that, most other chronic conditions will make you eligible, and not just eligible, but the reason you're eligible is because you're at higher risk if you get pneumonia or you get RSV. And so thank you, Dr. Parker. That's a good point, and I hope that helps explain, who else should have it below the age recommendations.
And I appreciate your expertise in looking that up, because I've been reviewing board questions and I'm like, is it PSV 23? Which one do I need to get?
Yeah.
And so that's really, really important. But the other thing that you talked about, and I thought this was important too, the need for a prescription for RSV. Back in September, I'm of the age where I have to get all of these things. I went to get my immunizations and they wanted to give me my RSV, but I took all 3 of the other things I had to take. I said, I don't want one more stick. So you can't just walk into CVS and get an RSV vaccine now if you're 65 or older.
Not yet. That's my understanding. And the reason was because it was not an age-based recommendation. It was above the age of 60 with shared medical decision-making. And so essentially the CDC and this little subset, the ACIP, wanted for people to have a discussion around getting the RSV vaccine. That has now been updated and changed. So I suspect that this will go away soon. And again, it becomes a barrier when you need a prescription versus it can just be given via a protocol.
Thank you. And I think that all physicians' clinics, and this is something important, if you're in a large healthcare system like we are at Emory, your doctor's office, your clinic may likely have both the flu and the COVID vaccines. A lot of private practice doctors may not carry all of those vaccines. So you'll have to go to your CVS or you'll have to go to your local health department to get them. And they're a disease preventative and most insurance covers it. And if you don't have insurance, you can still get the vaccines. You didn't mention it, but can you say anything about pertussis?
Yes, and I'm so sorry. As soon as you said about being around young children, I thought, I should have mentioned it. Pertussis is a respiratory illness, so pertussis is a component of what's called colloquially the Tdap or the tetanus. So it's tetanus and pertussis. So why that is super important, and I have to say that there was years ago some patient-facing information from the CDC, which was really, really powerful, but it showed a grandparent holding their grandchild and, talking about the risk that the grandparent was giving to the child because they could potentially give the baby pertussis. So if you think about little babies, most immunizations, not most, some immunizations we don't do to little babies. So for example, flu shots are not given to little babies. COVID shots are not given to little babies less than 6 months old. What happens is then that makes them vulnerable to things like COVID and flu and to something else, which is called pertussis. So the idea is that if we need to immunize everyone around the little baby to protect the baby from something that they cannot get themselves. So there is a very, very strong movement to make sure that everyone who's going to be around a newborn has the pertussis vaccination. And for most of us, that comes in the form of an immunization called the Tdap. So yes, pertussis is the same as whooping cough. And there are two tetanus immunizations. One is the TD, which doesn't have a cellular pertussis in it. And then the other one is the Tdap, which it has the tetanus, diphtheria, acellular pertussis, which that's why we call it the Tdap. So if you are going to be around a newborn, you absolutely must have your Tdap before you're around that newborn. ACOG has actually been very proactive about giving it in pregnancy. And now we're giving it to mothers every pregnancy, just to protect the baby from pertussis.
So grandparents getting ready to see their grandchildren next week over Christmas and New Year's. If you haven't gotten some of these vaccines, you need to.
Absolutely.
Simply because you want to not be as healthy as you can be. We've just talked about newborns getting whooping cough, but a lot of our children are in daycare and they carry the influenza and the other viruses or respiratory illnesses that can make it more likely that we develop a lower respiratory tract infection or a pneumonia. So immunize yourself so that you are less likely to be sick. So if you wouldn't mind, Dr. Alfonso, remind them of why we get immunizations. Not just because we need to have them, but why do we get these immunizations?
You know, immunizations are sort of a bilateral thing, okay? You get immunizations to protect yourself and to protect others. It is one of the best ways to decrease the burden of disease as a community. But it is, you also protect yourself, you know? It's the reason that healthcare providers are required to have a flu shot. There's lots of young, healthy healthcare providers out there, but we become immunized to protect our patients because I could just have a little sniffle that I think is, oh, allergies, but it's actually influenza. And I give it to my 88-year-old patient and they end up in the hospital and die. So it is really a bilateral act when you immunize. It's to protect yourself and to protect others.
There is one question in the chat that I didn't really quite understand. Patient Star says the RSV statement was unclear. I was told that over 75, I did not have to take that vaccine. I've had all the others. I'm not sure what that misinformation was. Can you just repeat the indications for the RSV, please?
Sure. This is actually the new recommendation that over 75, everyone should have it. RSV. New recommendation from the CDC as of October. After 75, you should get it whether you are healthy as a horse or you take 14 medications. Below the age of 75, between 60 and 75, it is sort of a shared medical decision-making based on your underlying health conditions.
Thank you. Thank you very much. Can you scroll through? I'm looking over here. Yeah.
Sure. Let me see if I can pull up the chat. Let's see. Yes, so I see someone got the pertussis before their granddaughter was born. That's awesome. So how often do you need a pneumonia vaccine? That is a great question. And once again, the recommendations have changed multiple times over the years. So, and I say this to the residents, you can always respond with it depends. It depends. It totally depends on what you've had, how long it's been. If you have had, I can tell you, if you've had the PCV13 and the PPSV23, and it's been more than 5 years, you are eligible for one of the updated pneumonia shots, okay? But there are so many different combinations of what you might have gotten in the past that I really urge you to talk to your healthcare provider about it. We had a previous question. If you've already had the PCV20, when should you get the PCV21? You actually, the recommendation today is you don't need, if you've had the 20, you don't need the 21. I will go ahead and tell you there's a high chance that that may change 5 years down the road. But for right now, unless you are in a very specific category, like you have you're on dialysis, those are the folks that need the pneumonia shot every 5 years. But most people do not. Okay. And again, I encourage you to, if you have a question, go to your healthcare provider and talk to them about it, because they will, if you've had these in Georgia, we can look up what you've had specifically. Most people don't remember. I threw away my COVID card recently. I didn't remember all the COVID shots I had, and I certainly didn't remember when I had them. So let the system work for you and pull up our grits and let them look at exactly what you got and what you're eligible for now.
So for people who don't know, GRITS is the Georgia Registry for your immunizations, even for babies. So you can't remember. I never remembered my children's vaccination records. I always relied on the health department to tell me what they needed. You can, any immunizations that you've gotten within the state of Georgia are recorded, in a vaccine registry. So it should be very easy to pull up in your pharmacy's office, in your pharmacist's office, in your doctor's office. They should be able to tell you which one to get. There is a question in the chat about, I can't remember which which tetanus I got. What should I do?
Yeah.
Go on.
Well, so my recommendation would be to just get a Tdap. It's not going to hurt you to get another Tdap, but it will be potentially detrimental if you just get a tetanus without the acellular pertussis and you expose someone or yourself. You are exposed to pertussis and you get it. As I mentioned earlier, in pregnancy, we are now recommending it with every pregnancy. So it is okay to do that. To just, if you don't know and you don't have any way of getting the record, just go ahead and request a Tdap.
Thank you so much, Dr. Alfonso. And just for recap, everybody, these slides are going to be available. The whole presentation will be up on our YouTube website next week. Mrs. Hart's going to put them up on our website. You'll be able to access these slides. And if you're in doubt, go to your pharmacist and just ask, which ones have I had? Which ones can you give me? And they'll be able to tell you what it is you need to get. So if you haven't had your flu or your COVID vaccine, please go and get it. We're starting to get into the midst of flu season, and these viruses do coexist. You can have COVID, you can have influenza at the same time. As Dr. Alfonso pointed out, we get immunizations to prevent hospitalization and to prevent death. So it doesn't mean that you won't get the infection, but you're less likely to die from it by having these vaccines. And if you got your COVID vaccine in September, in 6 months, you're going to want to go and get a booster, particularly if you're somebody who's immunocompromised, because these respiratory viruses are still with us. And if we're of a certain age and we have certain illnesses, we're at risk for contracting them. So if you can't remember, and we are not required to remember everything, just go to your local health department, go to your local CVS or your Walgreens, and they can pull up your immunization record and tell you what you've had and what you need to get. Thank you so much, Dr. Alfonso, and we look forward to hearing from you more.